Hi, I'm Dr. Nick Walters from Mission Hospital Bangkok, and I'd like to talk to you about dengue fever. Dengue fever is an infection caused by a virus, spread usually by the bite of a female Aedes mosquito. This kind of mosquito tends to bite during the daytime, so that's the high-risk time for developing dengue fever. If you get dengue fever, the kinds of symptoms you might have are fever, body aches, headache, sometimes nausea, vomiting, sometimes even a little bit of loose stool. Sometimes people get some of the complications due to dengue fever, such as bleeding. This we call dengue hemorrhagic fever. Sometimes the blood pressure goes low, and we call this dengue shock syndrome. People with dengue fever need to be treated and managed carefully. If you think you have the symptoms of dengue fever, go and see your doctor. There's a blood test that can be done within 24 hours of acquiring the symptoms that can tell you whether or not you have dengue fever. This blood test, however, is not done in all places, but is available at our hospital. If you do have dengue fever, the doctor may or may not decide to put you in the hospital. I can tell you about 50 to 60% of my patients have to be treated in the hospital. The rest we can treat as an outpatient. The usual reasons for having to be hospitalized would be nausea, vomiting, having bleeding or very high risk from bleeding due to a low platelet count. Platelets are things that are in the blood that help the blood to clot, and dengue fever causes these platelets to decrease in number, thus increasing the risk for having bleeding during an infection with dengue fever. Sometimes people have to be in the hospital because they just can't look after themselves. Now, if your doctor feels that you're safe enough to be managed as an outpatient, the doctor will usually see you once every day until the infection gets better. Most people with dengue fever are sick for about a week. Usually, by the end of the infection, that's the time when the person's at highest risk for having some fever and, some bleeding. And so, because of this, the bleeding is the highest risk right at the end of the infection due to the lowest platelet count right at the end of the infection. If you do have some bleeding due to dengue fever, you need to be managed in the hospital. Normally, dengue fever is not a life-threatening illness in a young, healthy adult. However, in children and older adults who have other medical problems, it can be life-threatening. So because of this, it's important to be managed very carefully with the doctor. There is no medication to prevent dengue fever. There is no vaccine to prevent dengue fever currently available on the market. However, there are some vaccines in human trials, and hopefully in the future there will be a vaccine to prevent against dengue fever. Because of that, when we do treat dengue fever, we don't give any medicine to kill the virus itself, but we manage the complications due to the virus, such as vomiting or dehydration or bleeding due to a low platelet count. People with dengue fever can be managed in the hospital. As far as prevention of dengue fever, as I mentioned, there isn't any vaccine. The best way is to prevent mosquito bites, and as I mentioned at the beginning, the mosquitoes that tend to spread dengue fever tend to be day-biting mosquitoes. So when you're out during the day, make sure you put on some mosquito repellent and travel well. Thank you very much.